Hi, this is Jacqueline Brumwell, and this is my Unit 3 skills validation for the physical assessment. This is my apartment, and that's my mother, Marcia Brumwell. And as you can see, there's nothing up in my apartment to cheat with. These are my workbook pages that are complete. And on to the physical assessment. Well, I'd go into the patient's room and I'd verify their name by asking them what their name is, verifying it on their chart, and double checking their name, their wristband for their name and date of birth. And I'd explain the procedure that we're going to go through. I'm Jacqueline, I'm the nurse here, and I'm going to be doing a physical assessment on you. And I'd obtain the patient's height and weight, and get their height by having them stand with their back against the wall and with their feet against the wall and measure at the top of their head level. And their weight just by standing on a scale. And I take their blood pressure, making sure that the cuff is the correct size and that the artery mark on the blood pressure cuff is over the brachial artery. And normal blood pressure is less than 120/80, and hypertension is 140/90, and hypotension, which is low blood pressure, would be less than 90/60. And I take their pulse, their radial pulse, and I'd count that for a minute. A normal pulse is between 60 and 80 beats per minute for an adult, and tachycardia would be greater than 100 beats a minute, and bradycardia would be less than 60 beats per minute. I take their temperature and make sure that if I'm taking their tympanic temperature, that the thermometer is pointed towards the front of the ear to get an accurate reading. The normal temperature for an adult is 98.6 degrees Fahrenheit and 37 degrees Celsius for an adult. The average range is between 97.5 degrees Fahrenheit and 99.5 degrees Fahrenheit, and 36.4 degrees Celsius and 37.5 degrees Celsius. And while I'm taking their pulse, I would also count their respirations, making sure that the patient isn't aware that I'm taking their respirations, because it can affect the count. Normal respirations for an adult are about 12 to 20 per minute. If it's less than 12, it'd be bradypnea, and if it's more than 20, it'd be tachypnea, which is a fast respiration. Pulse. Did the pulse, blood pressure, temperature, respirations. And you'd ask the patient, are you having any pain?
Not at this time.
Okay. And I would obtain a medical and surgical history, asking them if they're allergic to any medications, if they've had any recent hospital stays, if they've had any serious injuries or any surgeries, and if they're having any illness today. And then I would move on in my assessment, and I would check the overall skin integrity from head to toe, making sure there's no lesions or redness, swelling, if there's any skin breakdown or abrasions. And then I would move on to the neurological assessment, and I'd see if the patient could Obey any commands, like can you touch your left finger to your nose? Great job. Or asking them to turn their right ankle, or different commands to make sure that they're able to follow directions. And I see if they're orientated to person, place, and time, asking them what their name is, where they are, and what day it is, to make sure that they're able to comprehend. Oh, and to check for sensation, lightly pinch their fingers to see if they can feel that, or their toes, or if they can feel a soft brushing feeling on their cheek. And check for extremity strength to make sure that it's equal in both left and right side. So I have her squeeze my fingers and note that it's equal on both sides, or have her press the soles of her feet against my hand at the same time to see if the left and right side are equal, or have her bend her feet up towards the front to check the strength in her feet. The next part of the neurological assessment would be to check their pupils to make sure that they're equally round and reactive to light and accommodation. And I would take a pen light and flash it in her left eye and see if the pupil constricts. And then I would do it again and looking at the right eye to make sure that the right pupil constricts. And then I'd go on the right side and flash it in her right eye and see if the right pupil constricts, and flash it again in her right eye to make sure that the left pupil constricts. And that's called consensual response. An accommodation would be holding an object out here and watching the pupils constrict as the object gets closer, and have the pupil, or watch to make sure the pupils dilate as the object gets farther. And then check the cardinal signs by having the patient follow an object with their eyes, not moving their head, to make sure that their eye movements are correct. And then the 6 cardinal signs. And now we complete the neurological assessment. And next we'll do the cardiac assessment. There are 9 different pulse points. It'd be the temporal, the carotid, brachial, and radial, femoral pulse, popliteal pulse, the posterior tivus, and then the dorsal pedis on top of the foot. You'd also check for edema, like swelling, and it would be pitting edema if you press your fingers into their skin and it stayed indented. There's different levels of that. And then you move on to listening to the heart. You listen to the S1, which is the love sound, and that's found in the 5th intercostal space, left midclavicular line, so just below their breast. And that would be the apical pulse, and you're listening to the tricuspid and mitral valves closing, and you count that pulse for a minute, noting any irregularities in the heartbeat, or any missing beats, or any swishing sounds which would indicate a murmur. You listen for a minute, and then you also listen to the S2, which is in the 2nd intercostal space, just to the right of the sternum, and that's the dove sound that you hear. And you listen to that for a minute, noting any irregularities in it. Next would be like the lung assessment, and the left lung has 2 lobes and the right lung has 3, and you're auscultating to listen to any adventitious sounds, which would be abnormal sounds, such as wheezes, which would be like a high-pitched musical noise that you'd hear. Ronchi would be low-pitched noises, and stridor would be like a croaking sound. Crackles, I don't know if I did those ones. Crackles would be like the rustling or the rubbing of hair in between your fingers by your ear. And then you'd start the lung assessment. You want to listen to the full lung and note similarities between the left and the right lung. So you'd start on one side and you'd listen, and then you'd have the patient breathe through an open mouth. And following the pattern of the lung. And then during this, you also want to make sure that the chest rises and falls equally bilaterally, so on both sides. And then you also want to make sure that the chest isn't barreled or concave. You want to listen all the way into their armpits, following the whole lung. And you do the same thing on the back. He thinks like a breathe. And now we complete the lung assessment. And the last assessment that we have to do is the abdominal assessment. So you have the patient lay down in the supine position, so on their back. There we go. This way. And the first part of the abdominal assessment would be to inspect the skin, make sure it's not inflamed or. The next part would be auscultation of the bowel sounds, and you do that in each of the 4 quadrants, and you listen for a minute in each and count the bowel sounds. Normal bowel sounds are between 5 and 30 sounds per minute. Less than that would be hypoactive, and more than 30 would be hyperactive. And if no bowel sounds are heard in each of the 4 quadrants, it would be inactive bowel sounds. And again, in each of the quadrants for 1 full minute. And then the next step would be to palpate, or percussion would be the next step. And you just hold your middle finger over one of the quadrants and tap it lightly with the other finger, listening for any noises. Dull noises would be over an organ, and if it was a resonant noise, it would be an air or gas in the abdomen. And the last step to the abdominal assessment would be to palpate the abdomen, and you would just press down